Another patient, Jeff, is asking, Dr. Maddocks, I'm currently in an observation stage of non-Hodgkin lymphoma. I get blood work twice a year and scans once a year. I'm hoping it stays slow growing. How long on average can a person live in observation mode before treatment must occur?
So this is another great question, and I'm gonna provide kind of an overview that will kind of set up because there may be more questions like this. But in general, follicular lymphoma is not one disease, which I'm sure since this is a program focused on relapsed refractory follicular lymphoma, a lot of patients have heard this and know this, but it's what we call, it's very heterogeneous, or it can behave very differently in patients, meaning that some patients will have very indolent disease, and then there's a small portion of patients whose disease will be more aggressive. We know that when we diagnose patients with follicular lymphoma, there are some patients that are diagnosed and require treatment pretty quickly, whereas there are other patients that go many years, many, many years without requiring treatment. Some of that is because of the disease, and some of that is because of how we find a patient's follicular lymphoma. Some patients, we don't find it until they present with symptoms. Some patients find their own lymph nodes, and some patients are diagnosed because they have a baseline scan that, for a totally different reason, maybe get into a car accident, have scans to make sure nothing's broken, you find an enlarged lymph node, you biopsy it, and you find this diagnosis. All that said, there are some studies that have looked at patients who are on observation or watch and wait, and looked at treating patients who have what we call low tumor burden, or not a lot of lymph nodes or not very large lymph nodes, but have what's called advanced stage disease, so lymph nodes on both sides of the diaphragm, not large enough to necessarily require more aggressive treatment. They don't have symptoms, but we've looked at studies treating those patients with observation or watch and wait, or single agent rituximab therapy. And when you look at the patients in those trials, the median time to needing treatment for patients from observation was 3 years. However, there were 30% of patients, so 1 out of 3 patients, who were still being observed at 10 years without requiring any therapy. So there are patients, that's almost a third of patients at 10 years who've been observed, not required therapy in that population of patients. And certainly I, have been practicing for a while where I've seen patients. I do have some patients who've gone longer than that without needing therapy.